chemistry is included with the properties of and changes to atomic nuclei as opposed to traditional chemistry which include properties and changes that related to electronic structure of atoms and molecules, also the subfield of chemistry that dealing with radioactivity, nuclear processes and nuclear properties. The inventor of the nuclear chemistry is Marie Curie. She was motivated by Antoine Henry Becquerel's discovery that uranium mineral can emit rays that capable of exposing photographic film even if the mineral is wrapped in black paper. In the field of nuclear medicine, nuclear chemistry plays an important role. Nuclear medicine is a rapidly developing branch of healthcare that utilizes short-life radioactive isotopes to diagnose illnesses and to treat specific diseases. Nuclear chemistry synthesis radionuclide drugs that are pumped into the patient by nuclear reactors or accelerator and then search for particular organ that cancerous tumors. Diagnosis requires the use of the radiopharmaceuticals to generate a picture of the tumor or organ in order to detect the problems that may be missed by X-rays or physical examinations.
Okay, next we are moving to radioisotopes. Radioisotopes, also known as radionuclides and radioactive isotopes. Radioisotopes occur both naturally and artificially. The natural radioisotopes came from terrestrial sources, extraterrestrial sources, and also internal sources. The artificial radioisotopes are man-made and they came from nuclear reactors and accelerators. The radioisotopes are non-chemically unstable and they will decay to a more stable isotopes while releasing alpha radiation, beta radiation, or gamma radiation. The alpha radiation has a very high ionizing power but very low penetrating power, while beta radiation has a very high penetrating power with low ionizing power. Above all, gamma radiation has a very high penetrating power and it is the most common mode of nuclear excitation. Radioisotopes are used in various fields such as medical field, agricultural activities, for research, and also in war. For medical purpose, radioisotope with shorter half-life were used because it will reduce the radioactive exposure towards the patients and medical staffs while it is easier to handle.
Next is about medicinal uses. So what is medicine? Medicine is the field of health and healing. It includes nurses, doctors, and various specialists. Medicines are chemical or compound that used to cure, prevent disease or help in the diagnosis of illness. So there are many ways that it can be delivered, such as liquids that are swallowed, drops that are put into ears and eyes, cream, gels or ointment that are rubbed into the skin, inhaler like nasal spray or asthma inhaler, patches that are stuck to skin, tablets that are placed under the tongue, and injection or intravenous medicines. The objectives are first to explain and define nuclear chemistry. Next is to explain and define radioisotopes. To explain the relationship between nuclear chemistry and medicinal uses. To explain the function of iodine 131 in diagnosis thyroid disorder. To explain how iridium 190 to apply in brachytherapy. To explain the application of cobalt-60 in treating cancer. To explain how gallium-67 applied in radiopharmaceutical, and last is to explain the application of technetium-99m in scanning medical condition and guide cancer procedures.
Next is methodology. We did our discussion through WhatsApp group and video calls, and through this discussion we understand more about our task and also we decided on our focus topic. Through this discussion also, we appointed each member their respective part in finishing the report so that each of us contribute equally and also receive equal benefits. Next is about collecting data and information. We collected data regarding our main topic, which is nuclear chemistry, and our focus topic, which is the application of nuclear chemistry in medicinal uses. And for our focus topic, we have chosen 5 radioisotopes, which are technetium-99m, gallium-67, iridium-192, iodine-131, and also cobalt-60. The first study material that we refer to is the lecture note given by our lecturer, which is Dr. Yusnita. To further our research, we use study materials such as journals, books, ebooks, official websites, and articles that we mainly found through internet. The most frequent internet resources that we use are Pustaka UPSI and Google Scholar.
In the beginning of 20th century, doctor has started investigating the use of radiation of a method of cancer treatment. The use of cobalt-60 radiation machines is one of popular ways of using gamma radiation for cancer treatment. Cobalt-60, which is manufactured commercially and used as a tracer and radiotherapeutic agent, is the most common radioactive form of cobalt. The gamma rays that emit by cobalt-60 are harnessed by the radiotherapy instrument that is highly efficient in reliably delivering a high dose of radiation to the tumor area and preserving surrounding healthy tissue. Radiation of cobalt-60 therapy is an important technique for shrinking tumors. The cancerous cells are targeted by high energy wave. So, the cancer that are treated with radiotherapy using cobalt-60 is such as prostate, skin, head and neck, throat, larynx, breast, brain, colorectal, lung, bone, leukemia, ovarian, and uterine.
Next, we go to gallium-67. Gallium-67 is used for radiopharmaceutical. Radiopharmaceuticals are radioactive agents which may be used to find and treat certain disease or to study the function of the body's organs. Gallium citrate 67 injection is used to help your doctor diagnose if you have certain types of cancer such as Hodgkin's disease, lymphoma, and or lung cancer. Furthermore, gallium-67 is an injectable radiopharmaceutical that is used with single photon emission computed tomography imaging to detect the presence of acute inflammatory lesions and various mechanisms.
Iodine-131. Iodine-131 is a radioactive with a very short half-life of 8.02 days, making it highly radioactive. It is frequently used in small doses in thyroid cancer therapies. Iodine-131 only took a couple of radioactive atoms that required to be inserted into the bloodstream for iodine PAP to be accurately monitored. It is an analgesia to be used in humans. Radioactive iodine-131 are often utilized in medical therapies as a treatment and a diagnostic tool. It is most ordinarily utilized in the treatment of hyperthyroidism thanks to graft disease or a nodule within the thyroid. Treatment with radioactive iodine in therapeutic doses is well tolerated and is taken into account to be a secure and effective treatment for hyperthyroidism. The majority of the radioactive iodine is eliminated from the body through natural decay with the first 35 days following administration, with total elimination several weeks later.
Next, we go to iridium-192. In medical, iridium-192 usually used in brachytherapy. Brachytherapy is a form of internal radiation directly at the tumor. This therapy is administered by specialized doctors only, usually radiotherapists. The radiation source of iridium-192 can destroy the tumor from a short distance. Depending on the size, shape and location of the tumor, the source of radiation will be removed. from the patient's body after a few minutes. This is an effective way to treat the tumor. Without an operation, the patient and the healthy tissue will not be exposed to radiation any longer than strictly necessary. Besides, brachytherapy, especially using manually after loaded iridium-192, has been widely used to treat head and neck cancers. HDR brachytherapy has been used in selected cases to reduce radiation exposure and permit optimization. Iridium-192 has a half-life for 74 days. This means that after 74 days, only half of the iridium-192 is left in the radiation source. At that point, the source in the afterloader will have to be replaced. One source can be used for a longer period of time and can be applied for multiple patients.
Okay, the last radioisotope we are going to discuss is about technetium-99m. Technetium-99m is a silver-gray radioactive metal that has a short lifespan, about 6 hours. The short half-life is very beneficial because it will reduce the radiation exposure for both patients and medical staffs. Also, because it has a very short half-life, it is easier to handle the waste. The two most familiar uses for technetium-99m are scanning images, medical scanning, and also to guide cancer procedure. Organs that can be scanned using this technetium-99m includes heart, gallbladder, liver, brains, and also bones. The ability to scan inner organs with technetium-99m really help determining the location of damage that occur in human body. For brain scanning, technetium-99m helps physicians to detect strokes and dementia, while for bone scanning, it helps physicians to detect any skeletal damage to ease further action needed to heal the injury. To detect cancer, the patients were given technetium-99m through injections, and the technetium will flow throughout the patient's body, and then the physician will use gamma camera to detect the location of the tumor. The preparations of technetium-99m is highly facilitated with presence of commercial cold kits that contain lyophilized formulation. The preparation of technetium-99m from molybdenum-99 by using aseptic techniques has been implemented with good manufacturing practice by European Economic Community 1997. There are two types of technetium being used in hospitals. One is prepared as kit, and one is prepared instantly. So that's all for technetium. Thank you.
From this chapter, the conclusion is the common understandings is that nuclear chemistry requires only the study of radioactive nuclei. Development in modern instrumentation for mass spectrometry has made it increasingly necessary for chemical studies using stable, which is a non-reactive isotopes. Nuclear chemistry greatly helps on the understandings of medical treatments and allow these treatments to improve. Radioisotopes play an important role in medicine. For the diagnostician, small harmless quantities of many isotopes serve as tools to aid him in gaining information about normal and abnormal life process. We foresee steady improvement and growth in all uses of radioisotopes in medicine. The isotopes of lead are very radioactive and have a direct effect on the brain and nervous system.